Hello, welcome to RT 220 RT Checkoff packet for the students. The RT 220 course is the first course in the respiratory therapy program. And if we scroll down in the document, you'll see there are many goals that the student has to complete so that they can progress in the program. The goal of this course really is to introduce the students on the hospital structure, how the director works in the as a respiratory therapy director, what's their role. The students also does their first patient interview, and they turn that into an essay. They also write the essay as a team for the director when they interview the director. There are clinical objectives that I can show you in the next few sheets, and then of course there's attendance, the yellow card. The students keep track of all their goals throughout the semester under data arc, and the student receives an affective evaluation at the end of the course from the clinical instructor, which is you. In this packet, I will scroll down and I'll show you a couple of things so you understand the setup. If you start reading on page 5, week A, B, C, there's 7 weeks. So some students might start on a day where they're going over charts, which is week B. Going over patient charts, they're doing a nebulizer treatment. On another week, then they can go interview the director. These weeks are not in order and they're very much interchangeable. And if you go to C, there's laboratory, radiology, EKG. They can visit different areas of the hospital. In week D, they could do vital signs, start introducing themselves to patients. So the students that you will be receiving, they're very much new to healthcare in most cases, and they're very shy and timid. Your goal is to have them present themselves professionally to these patients who are strangers and really take care of them. Then eventually in different weeks, the students can do different roles depending on what is available at your facility. They can watch a bronch. One person can be looking at a chart. Another person can do a nebulizer treatment, but they consolidate with you at the end of the day. The total number of hours that are needed for the students are total 35, so it's a 7-week course. They come every Wednesday or Friday. Fridays are difficult, but we can do something if you really need to move them to Fridays. But most folks will be doing Wednesdays. Their main project here is the patient interview. They've never seen a patient interview, so you want to emphasize how you approach them, how to ask them open-ended questions versus closed loop, yes, no questions, to get more information. The best patient to choose is the very talkative ones, and they like to share information. That way, students feel welcomed, and then they can finish this project. So how to choose your patient, chart information, and patient interview skills here. They're all listed here. I'll have you read those. A lot of the COPD patients tend to be really good interviewers as well, and it's a really fundamental disease that we cover in the program, so those would be good. Then we have the rubric for the students to follow for that write-up that they do for the patient interview. And then there's the group essay. The group essay is that they are going to interview the department director, whoever is at the highest position in the department. It could be you, or it could be not the title of a respiratory therapist. You have to have the head of the department. That way, the students learn the hierarchy and what are the options. What were your struggles? How did the director figure things out? And why did they choose this position? The students must bring 2 questions with them, ask that at the interview, and everybody just makes one essay and then submits it to me. And then I again grade that. That's director interview rubric. At the end for the essay, they evaluate each other for if they participated well or not. Um, and then they score each other. That way, if there's any issues that one of the students is not helping out, You should be aware, and if you find out that they're having trouble, I should be aware right away. At the end, I've placed 7 sheets that have the daily rubric and the daily evaluation. So this daily evaluation, the student must write their goal. That's part of our rubric requirement. Then you would give a comment and then sign it. And then I've also provided a hint here for you to remember that if there's HIPAA violation, something major, you send them home. You must record this in their purple chart, purple folder in this daily rubric, and then keep a copy of it and then hand it to the student. The student must be notified why they're going home. Okay. Here's the rubric. I will leave that to you to read. And then there's a bunch of these different days, that front and back. So each day that they're with you, they should get an evaluation on this sheet with a date, day 1, and then they should also get a rating on the rubric. I want to remind everyone that we are not going to give them the rating that the student wants. We're going to give them the rating that they deserve, or they're at their level, so they actually have a chance to improve. Again, with the rubric, 1, 2 is a fail for the day, but if it's a consistent issue, I should be reported. You should report it to me, and they should get 3, 4, or 5. Most folks will land in 3 and 4. That's perfect. And you should tell them that they don't have to be in 5. But definitely 5 would be someone who's very seasoned, but eventually they'll get there. Okay, so this is the purple packet that I started reading to you. So we have a title page, the summary of their goals. The pink highlights are all for what the students needs to do. They will submit this to me. This is your evaluation of per week, and that if you want to give them comments each week in this section, that's where you would do it. Like more of a summary. Hey, good job with this. I want you to use better posture when you approach the patient. Don't be shy. Be assertive, not aggressive, like keeping that balance. There are many types of, you can do any type of comment. It's more of like the summary for the day, in addition to the daily evaluation sheets. At the end, you can sign this off for them. If this is not signed, I cannot pass them, and this whole document should be filled by you. And every time they finish, for example, they do a nasal cannula, simple mask, you can do the initials here and check them off. The students also arrive with checkoffs from DataArc that have their steps. You can sign those off as well. The problem arises is that each facility has a slightly different protocol than the other facility. So we teach them something generic, but if there's something that you want them to learn, you can teach them that at that moment and expect that there's going to be variations the way the students come in. Okay, so I will see you in the next video.